good thing I can read. And who gets fatty liver? Who is more likely? No, you go ahead and answer, please. No. What's that? You? Why do you think that? Oh, okay. All right. Did you get it checked? Whether you have fatty liver? And were you diagnosed with that? Okay, cool. So they had, okay, so we'll talk about it when we get that slide in a couple of, 2 or 3 slides. And so, yeah, anybody can get fatty liver. We associate it with being overweight, and conditions are associated with insulin resistance and things like that. But really, anyone of any body size and shape can have fatty liver, just that the prevalence tends to increase with the when there is higher weight and tendency towards obesity. So here's the thing about that. You would hope that you can detect it in the blood, right? That would be nice. And indeed, we know that things can go wrong with the liver and detect that in blood through testing, usually liver enzymes. And what causes liver enzymes to spill into the blood? The breakdown of liver cells, basically. So that's not a good thing, right? And what might cause liver cells to break down? What's that? Bile helps. Well, we don't want liver cells to break down.
I'm sorry, my bad. I was talking about.
Okay. So what might cause liver cells to break down? Go ahead. Toxins, yeah, toxins, okay. Inflammation. Alcohol, yeah, for sure. All these things are pressures, are stressors, right? Right, we know that, for example, when people take cortisone shots for a long time or cortisol pills for a long time, they're at high risk for breakdown of all sorts. Their bones break down, the muscles break down, so overall stress in the body causes breakdown of things. So that's not a good situation. But you can have fatty liver and not have necessarily inflammatory markers and liver enzymes and all that situation. It's a slightly different process. So in order to determine if someone has fatty liver, you need to actually get imaging done, either an ultrasound or an MRI. So the lady who said that she was diagnosed with that, did you get imaging done? Yeah? Which one? Ultrasound, right? That's the easiest, right? And don't ask me to interpret that. I'm not a radiologist, but it can be seen. You have to actually see it, visualize it to make sure that you have fatty liver, right? So that's how you diagnose it. Now, you can have signs and symptoms. So we're not getting this fixed. I have to do this. I'm gonna have pain in the neck, but yeah, I might as well stand here. But anyway, so these are symptoms. Can you hear me like this? No? It's not a good thing. Turn the mic? I don't have a portable mic. Might make you know that. All right. All right, so these are symptoms that can accompany fatty liver, but they're not super specific, right? Fatigue is not a super specific sign. A lot of things can have fatigue accompany them, a lot of health issues. Certainly stress, right? And right abdominal discomfort can give you a hint that there is sluggishness, sludgy bile happening there, and that can be a sign of fatty liver, but it can also be a sign of other digestive issues, usually related to the liver and gallbladder, right? Bloating and indigestion, again, that can be different things. And same with nausea and loss of appetite. Unexplained weight gain, yes, if fatty liver is associated with increase in weight and so on. Brain fog and low motivation can be, can be anything really. It can be fungal infection, dysbiosis, malnourishment, and mild jaundice. Again, not necessarily associated with fatty liver, but there is bilirubin spilling into the blood, maybe because bile is spilling into the blood, so maybe there's too much fat in there and the bile has to squirt it out, perhaps, yeah. All right, so what's next? So how does fatty liver affect liver detoxification? Let's go down for a second, actually no, up. I want to ask you a question. So, how many of you are retailers here? Or work in a retail store? Okay, cool. So, you guys sell liver detox products, right? What do you typically sell liver detox products for? Like, does someone come in and say, I got all these toxins, my doctor determined I got all these toxins in the liver, fix that for me, right? Right, so what do you typically...
Most people just come in wanting a liver detox.
Okay, all right.
Tell us the symptoms.
Yeah, makes sense. Most people come in asking for it, and because of the symptoms, they tell you what the symptoms are?
No, they don't.
Oh, they don't tell you what the symptoms are.
They just think they know and they want a liver detox.
Right, okay. So what else might influence your decision in kind of recommending a liver detox? You ask questions? What kind of questions?
Well, the symptoms we ask.
Related to some of these things?
Yeah, exactly.
Yeah? Okay, cool. Anything else? Medications, okay. So medications might cause some stress on the liver, back things up, right? History of alcohol, which can contribute for sure to fatty liver, right? Yeah, absolutely. So here's the thing, fatty liver can cause issues with detoxification, and that's the problem because the liver is a detox organ, right? All right, so let's look at some of these. So it impairs phase 1, phase 2 detox. These are associated with enzymes called P450. You must have heard of these terms, some of you, right? Phase 1, phase 2. What does phase 1 do? It basically disrupts in a way, makes something more reactive, a substance that has to be detoxed more reactive, in order for it to react with something in phase 2, to conjugate to something, right? So how do you get, for example, all the minerals out there that you guys sell, magnesium, the calcium, they're all bound to something, right? So you gotta make something more reactive so it can bind to different things that, including glutathione, heard of that, right? And flush it out, make it actually, that binding usually makes the toxin more water soluble. So it's easier to carry it out of the liver. And I think I'm missing a phase, or maybe I'm not. It actually, I think there's a missing slide here, but it reduces glutathione, and as a result of that, I can actually speak to that because it's very, very much relevant to that. So when you're not able to carry out phase 2, then you can't carry out important toxins like medications, excess perhaps, certain drugs, excess alcohol, right? Excess unwanted hormones, for example, so can be an issue in estrogen dominance, where you have symptoms of estrogen dominance, which you might be familiar with, right? So hot flushes or PMS, depending on the age of the person. So these sort of things. And it also decreases the presence of glutathione as well, fatty liver, which is an issue because glutathione is hugely important for this process. And the other thing is, of course, digestive issues associated with leaky gut. And, we're all about probiotics. So to support gut health, but you got to be careful because you need bacteria in the large column. So the picture on the right there, the large column is the green area. That's where you want your bacteria. You don't want your bacteria in the middle, which is the small intestines, where you absorb your food from. That's the permeable area that you absorb your food, your nutrients from. And so you might end up absorbing byproducts of bacteria known as endotoxin or lipopolysaccharides. That's not a good thing. And how does the body deal with that? It actually uses lipoprotein, which is closely related to that. We'll talk about it in a second, to mobilize them. Lipoprotein are made in the liver. So again, fatty liver can contribute to excess burden of these endotoxin. Okay. So how do you deal? By the way, so what do you do if you have someone with small intestinal bacterial overgrowth? How do you know what to do? Like, do probiotics work all the time? What do you do? You actually have to go for antibacterials, right? And you got all kinds of antibacterials available for you. All right. That's a slide. Okay, we found it. Okay. Never mind. We spoke about it. And yes, there is reduction in bile flow, which is also an issue. And that's going to affect cholesterol. It's going to affect, as I mentioned, detoxification of hormones and so on, and can contribute to fat malabsorption. So this is another sign. Another sign is, we talked about some of the symptoms associated with fatty liver, and there might be pain and congestion and heaviness here, especially over the liver area. And so if the person tells you that that happens typically with a high-fat meal, then that's another clue that might be dealing with that. Might be dealing with cholestasis, so sluggish bilirubin, not bilirubin, but sluggish bile movement through the liver, often associated with excess fat deposition in the liver. So if fatty liver is suspected and you wanted to support liver detoxification, would it make sense to help remove fat from the liver, right? So your approach to detoxifying the liver, if you suspect fatty liver, has to focus on that. Or that has to be one important aspect of it, very important aspect of it, right? So what does the liver normally store? Let's go back up for a second. So here we're talking about storage of what? Of fat, of fatty acids, fat in the liver. What should the liver store? I'll give you a hint. To be happy, especially at night when you're not eating. Glycogen, absolutely, right. So when someone wakes up at between 1 and 3 o'clock, that could be largely because glycogen storage isn't good, glucose isn't available while the person isn't eating. And that's a problem. When you're hungry, you're mad, right? Your body gets mad when it's hungry, even when you're sleeping. Wakes up. So yeah, all this pasta and rice and noodles, on that stuff, that's what it wants to store, okay? Makes you wonder about this low carb stuff. So is it fat consumption? What causes fat accumulation? Fat consumption, carbohydrate consumption, inflammation, poor metabolism, excess fat food consumption? Probably a combination of all these things, right? Now, having said that, most carbs, especially glucose, our main carb, is used for energy, used to make glycogen. Only a small portion of it actually turns into fat. And one of the value of B complex, especially with B3 in it and some supportive vitamins, is it helps support that conversion, reduce the conversion of glucose into fat. Really, it's meant to store glycogen. How much glycogen can we store? How much glucose or glycogen can we store in our body by weight? So about 100 grams or so in the liver and about 300 grams in our muscles, right? That's a lot of pasta. It's a lot of rice. Now, there's issues with fructose turns into fat narrative because there's some suggestions that, yeah, you gotta avoid, when you listen to speakers about this out there in the speaker sphere, they would point out studies that, supposedly prove that fructose is an issue, but usually it's taken out of context where it's not balanced. It's like just fructose on its own, and you don't really have any food that only fructose, right? And you have to have a very large amount. So under certain conditions, there's susceptibility, but the really main culprit from a dietary point of view is the stuff on the right there. It's the vegetable and seed oils. That's really bad stuff. That makes it hard for it to actually blocks. Fat in general blocks glucose metabolism. But that stuff causes excessive oxidation. It's broken down into aldehydes that cause further toxicity and stuff like that. So that's the stuff you want to avoid. And of course, there are environmental toxins which are not easy to avoid, but ideally, we try to eat organic and things like that. So, having a little bit of fat in the liver, the person is healthy, doesn't have symptoms, feels okay, good energy, not a big deal. But you want to avoid it going into the NASH state and obviously the cirrhotic state. And you see the processes in the middle there that would contribute to the development of those states. One thing that I would pay attention to, for example, also that is missing that kind of relates to some of the things I've spoken in the past is serotonin. Serotonin can drive that into cirrhosis. So we, spoken about before about how serotonin is not that happy hormone. It's actually problematic in high amounts. A lot of people take antidepressants which increase serotonin in the body. So, again, those are the sort of things, especially the stuff on the right and the bottom, that would contribute to, the situation heading to the right. So, you have to protect against lipid peroxidation and oxidative stress and inflammation which is driven by lipid peroxidation, oxidation, and you do that with our antioxidant defense systems primarily. And so, see, glutathione, its action, its replenishment is based on the presence of which vitamin is responsible for this here? Niacinamide. That's right, B3. Yeah. And vitamin E is super key, super important for the initial neutralization of the stuff on the right. Where does it come from? Come from grains, from nuts and seeds. Where do you find most of vitamin E in nature? In grains and nuts and seeds, right? So it's there for a reason. It protects the plant, and it's super important for neutralizing the negative effect of that sort of damage, of that sort of chemical damage. And vitamin C supports it, B3 supports it, and in the liver specifically, they work together in glutathione and other places as well, in organs like lungs and so on. So how do we get rid of fatty liver? So how many of you heard that choline is important for addressing fatty liver? Show of hands. Some of you? Yeah. And the reason is that choline is foundational. How do we mobilize fatty substances out of the liver? Part of an important piece of it is lipoprotein. So when you go to your doctor and they check for cholesterol, they don't just check for cholesterol, they check for lipoprotein. It's a complex, lipids and proteins, and lipids don't mix in water very well, in the blood very well, right? And so you need to have a protein complex to help mobilize it out and into tissues, depending on what the need is. And so that's how you mobilize excess fat, particularly fatty acids, TG, triglycerides in the middle there. Especially is that, and free fatty acids is how fat is mobilized out through this very low density lipoprotein, VLDL. It stands for very low density lipoprotein. It's basically a trucking system, right? The truck is the protein, the cargo is the fat, in simple terms. So choline is key for the production of phosphatidylcholine, which is key for the production of this complex, so super important. It's like the zigzaggy membrane around it, kind of conceptually. So choline is very important. Certainly there have been studies that have demonstrated that that's really important. And we need about 500 milligrams of choline, more or less. We can get some from eggs, we get some from organ meats. And if we need to, we can supplement the rest. Too much choline can be an issue too, so it's a balancing act as well. So if someone has conditions where they make too much acetylcholine, that's not good. So it's a balancing act. You gotta not too much and not too little. Of course, we all heard of milk thistle, right? And so as far as the medical literature, it's one of the two most studied and substances that have been shown to be most effective in natural substances in reversing fatty liver. And so basically it does a few things, a couple of these things. It inhibits key lipogenic enzymes. What does lipogenic mean? Production of fat. Right? And so those enzymes, it inhibits those enzymes that tend to promote production of fat. Too much fat production means too much fat is going to be synthesized inside liver cells or mobilized and sent to liver cells as well, elsewhere, and mobilized towards them. And milk thistle also supports fat export, so secretion and export of VLDL. It helps improve the health of our cells, our liver cells in general, and that's important for proper functioning of liver cells, including the secretion and export of VLDL. All right, the second most studied nutrient, might be a surprise to some of you, is vitamin E. Right, so, and it kind of makes sense based on what I told you earlier about how vitamin E is really important for neutralizing the stuff that is probably most harmful for our liver as far as, dietary sources go. There might be environmental things that are more harmful, but as far as our diet and most people's diet, vitamin E is super important for counteracting that damage. So, if you go to that study, and from info sheets, you can go to the study, you can see the different, it's a review actually, it's a review of multiple studies, and you can see there that in several studies, the administration of vitamin E decreased the amount of fat in the liver. So this is our alpha lipoliver. This is a product that I formulated for that purpose. Okay. As you can see, choline and milk thistle and vitamin E are at the top there. It's 3 capsules per day. The dosages you see are per capsule, but it's 3 capsules a day. And also it has vitamin C and B3. And folate and vitamin B12 also act on an enzyme that support the stopping the progression from fatty liver to that inflammatory state that can result in cirrhosis. And so, just a case study, I did training with a store the other day and just shared this information with us. A man in his 50s, history of alcohol consumption for 25 to 30 years, sober now. Not surprising, diagnosed fatty liver, and within 4 months, imaging showed no fat. Now, to be fair, they also gave him something else, and it was bourbon. Now, I'm not so sure bourbon would be my next choice, okay? Because it can also, taking too high of an amount over a long period of time, it interferes with an important mitochondrial complex. It slows it down. So bourbon I would use with discernment, smaller amounts, short period of time. Okay? But I've used this before with things like glycine, for example. Glycine powder, it's a good adjunct as well. Yeah. You didn't have a question? Someone? Oh, you did, okay.
How long would you recommend this for somebody who has?
So the studies that I've showed you lasted 6 months.
Okay. 6 months, 3 times a day?
6 months, 3 times a day, yeah. Yeah. Now, having said that, he had a follow-up test 4 months later, so.
Did you change his diet?
I'm not sure, I don't know. I didn't ask that question, that's a good point. Absolutely, yeah. But in his case, it was probably this long-standing or long-lasting alcohol abuse that was a major factor here. Yeah. How are we doing with time?
You're at 1:45.
1:45, so I have 15 more minutes?
Mm-hmm.
Okay, so 15 more minutes to kill? Just kidding. Don't have much more. All right, so, okay, so for those of you who wanted to learn about Shilajit, let's see what I can do. Can't promise anything. So it's a mystifying or esoteric substance. Anyway, so this is a study on rats, not on humans, but on rats, showing decrease in fatty liver disease, reduction of fat in the liver. So it has that potential. And so let's look at some of the things that it can do. Actually, hang on. I want to hear from you guys. What do you know about Shilajit?
It removes toxins and it binds to remove, you have to bind to remove the toxins. from
Yes, charged toxins. So
High in minerals increases testosterone, I think.
high in minerals increases testosterone. Yes. Now it's not a single substance, right? It has a whole bunch of things in it.
Isn't it just collected, like it's this ancient mineral that's...
Yeah, basically an accumulation of very old, decomposed organic matter.
Not from volcanic.
Not from volcanic. I don't think so. That's not what my understanding is. I don't have Shilajit in my backyard, but
Right.
that's
No,
not my.
somebody just mentioned that to me, I didn't know that.
Yeah.
And he mentioned that.
Yeah, well, maybe. I guess we'll have to find out. But that's my understanding. Basically, it's decomposed organic matter over a very, very long period of time, compacted, and just undergoes changes. End up with this tar-looking material, and it's found in the crevices between rocks, basically. So, I mean, could be. Volcanic activity could have something to do with it because usually it's in high mountains. High mountains are geologically relatively new. So for high mountains to appear and to erupt, then there's got to be something around. Maybe, yeah. So what else do you know about Shilajit? Yes?
It's Ayurvedic medicine.
Yes, so it's commonly used in Ayurvedic medicine for sure. Yeah.
People have a lot of interest in it.
People have a lot of interest in it. What are they telling you?
Doesn't taste good, but it works.
All right. For what?
Energy.
Energy?
A lot of men coming in though for testosterone.
It becomes popular after COVID. Or
Became
during
popular after COVID. Interesting. Okay. I wonder about the relationship. But yeah, energy for sure. So let's see how it might increase energy. So all right. So you got the main component has a lot of different components, and I don't know if we have those info sheets at our booth. You can come by, but basically we created this info sheet for you guys that shows the different pharmacological aspects of it, different things that are in it, a lot of different substances. Fulvic acid seems to be one of the predominant ones that we know that it does something that relates to those benefits that you mentioned and others as well. And so it's this very low molecular weight. It carries electrical charge, someone mentioned, which allows it to bind things, including metals. And it helps to bind, solubilize, a little bit like what happens in the liver when you got to detox the liver, solubilize material, and transport nutrients across cell membranes. So that's key, because if you can transport nutrients, more nutrients across, say, the gut member, the GI tract, or if you can transport nutrients across the mitochondrial membrane, where energy is being produced, if you can increase that, then you're likely going to have more energy, right? And so it supports the regeneration and increased mitochondrial numbers, because now the mitochondria is fed by more nutrients, so it's going to energize it. It's going to be more active. The cell is going to make more mitochondria. And I like that it can potentially be used to bind and flush out heavy metals without disturbing sensitive or redistributing it into sensitive organs. That's important, right? So very, very cool substance. Yeah. So we're working on more Shilajit products. Checking those from here. I know why I did that. All right. Just trying to change the pace. All right. So have 5 more minutes or 10 more minutes?
Yep, 10.
10? Okay, cool. I'm going to tell you quickly about a couple of new products, and then I'm going to take questions, okay? So what you see here is coenzyme Q10, and we sell coenzyme Q10, sell it to people usually for heart health, right? Increases heart function, heart energy. What else do you use CoQ10 for?
If you're on statins.
If you're on statins, and statin medications, adipase medications, certain blood pressure lowering medications, and others too interfere with coenzyme Q10 production. So very important for energy production. Why? Because it's part of this electron transport chain that is a complex in our mitochondria. That's where most of the energy is produced. And here's the thing about CoQ10. It doesn't work on its own. It works along with NADH and FADH and an enzyme, cytochrome C there, at the top of the green part, site C, that requires copper, right? So it doesn't work on its own. So ideally, we should be able to also provide these other nutrients when we recommend coenzyme Q10. So that's the basis for this supplement here, Enhanced CoQ10, right? Now, there's another thing about CoQ10. It's great for blood pressure, but Health Canada won't give you a claim for that. So we put in some green coffee bean extract, which automatically comes with a claim. And it has chlorogenic acid, which is a very energizing substance on its own. Tiny amounts of caffeine, only between 0.1 to 2% caffeine, so just a fraction of what you get from a cup of coffee, so there's no effect on the body. And so I think it's a very effective form of CoQ10 with 200 milligrams of CoQ10 per capsule. I'm not going to talk about this. Come to the booth if you'd like to discuss that. It's a comprehensive heart health support product. But just briefly about benfotiamine. Did you guys know, you're familiar with benfotiamine, right? So hang on, before you read that. What might be the advantages of benfotiamine? Good for nerves? What's that? Nerves. Okay. Here's the thing about benfotiamine. It's fat soluble, and 50 milligrams of benfotiamine are equivalent to 250 milligrams of thiamine HCl. And the active form of thiamine, TPP, Basically, benfotiamine has shown to deliver 21 times higher red blood cell levels of TPP compared to thiamine HCl. That's kind of neat, right? A lot more. So what are the applications of benfotiamine? So here are three, there are a few more listed on an info sheet, but this is kind of cool. Cognitive support in Alzheimer's disease. These are very interesting numbers, right? And kidney function support, 300 milligrams, shown to promise in slowing down, reversing kidney decline, particularly in diabetes. That's a big deal, right? Losing kidney function is no bueno. And of course, you guys may have heard already, diabetic neuropathy plays a role there too. Right? All right, cool. Any questions? Yeah. Does benfotiamine help with glucose? For sure. Yeah, absolutely. It improves glucose metabolism and utilization. Yeah, so here's an interesting concept. Sugar feeds cancer, yes or no?
Yes. Glucose and,
I'm not so sure.
or not.
What happens in cancer
Glutamine.
is that glutamine might, yeah. But basically, are you familiar with the biochemistry process of how glucose is broken down to produce energy? First you have glycolysis. It's broken down through 10 steps to pyruvate, right? And then once it's broken down to pyruvate, it can change to something called acetyl-CoA and get into mitochondria and really be broken down completely, oxidized fully. We're afraid of the term oxidized, to produce energy. But basically, in cancer, that doesn't happen. It goes to pyruvate and then it switches to lactate. And that's why higher lactic acid levels and lactic acid dehydrogenase are signs of high levels associated with poor prognosis in cancer. What B1 does, it helps convert it back to pyruvate and then to coenzyme A so it can be fully oxidized. So you got to switch the way glucose is being utilized, broken down to produce energy properly, and B1 is good for that. Now, it hasn't been shown to necessarily consistently lower blood glucose levels, but it protects against issues related to diabetes like kidney disease and neuropathy and so on. Yeah.
So if you're using it for nerve pain, would you use higher levels or just one a day kind of thing? Like 100
Yeah, so you'll have to go back to the studies on nerve pain. Yeah, and for sure, I mean, you can experiment with more and see how you react to it. Not everybody reacts, positively to. More is not always better, so you got to test it out. Yeah, exactly. Yeah.
I have a question regarding A-lipoliver and then Shilajit. Would you use those together for your clients?
Yeah, alpha lipoliver and Shilajit can work hand in hand for sure. Yeah, to reverse fatty liver.
And then I noticed like the B vitamins were like the formula, like the dosage was not enough. So would you supplement?
If you need to, yeah, in the alpha lipoliver.
Yes.
Yeah. It's all relative. So for example, you getting 100 milligrams of niacinamide per day. How much niacin, what's the recommended daily intake of niacin? It's about 15 milligrams. So you're getting a lot more than that, and you're already in the sort of the B complex ballpark, right? Yeah, when you look at the CoQ10, again, kind of trying to match the lower end of sort of, yeah, so 50 milligrams niacinamide, B2 at 5 milligrams, you don't need too much of that. And those are key for energy metabolism. But if you think that makes sense to give them additional B vitamins, for sure, go for it.
Just because it will cover like the other B vitamins that are missing that are also needed for whatever particular
Yeah, absolutely. Yeah, the other B vitamins that might need for sure. Yeah.
Question about the action of Shilajit, like, so because we have a lot of men that come in for boosting testosterone.
Yeah.
So for women, if women are, especially if like if they're going are trying to balance hormones or going through menopause or whatever it might be, like how does that?
So, a lot of people or a lot of men ask for Shilajit because it's purported to increase testosterone, and that's based on studies that it raises testosterone. But it's an adaptogen, so I'm sure that you can run studies on women. I'm sure there've been studies on other aspects, but it acts like an adaptogen. Yeah. All right. Do you have a question back there? 3 minutes? Okay.
How would you compare Shilajit to like zeolite for heavy metal binding capacity?
That's a good question. So I'm not an expert on either one, but how do you compare Shilajit to zeolite? So Shilajit has both of them have extra charges to bind toxins, to bind metals too. The neat thing about zeolite is it has this honeycomb shape as well. So there's that surface area, that physical surface area, which I'm not so sure if that happens with Shilajit. So that's a neat thing about zeolite. Yeah.
Does Shilajit bind to copper? Like, will that affect people's copper levels?
Would Shilajit bind to copper? It might for sure. So you always have to be cautious. Might be a good thing in people with fibromyalgia. In that case, there might be too much copper outside of the cells, not getting into the cells.
I just want to mention one study also showed that increased collagen production with Shilajit.
Brilliant. Okay, thank you. Okay, so cell to collagen. Yes?
Is it assumed if somebody's had their gallbladder removed that they will have a higher propensity of having fatty liver?
That's a really good question, and then I should know the answer for that, but I don't. I'm sure it's easy to find out. Do people without a gallbladder, are they more likely to have fatty liver? I would assume so. But yeah, I gotta find out. Yeah. Cool. All right. Thanks for coming, guys, and action.